Hello, I'm Angela Dorfman. I'm going to do an assessment for my patient. So, since it is not a clinic, it is my home, so we are going to pretend for some things. Obviously, before meeting my patient, I'm going to wash my hands and I will observe my patient walking, gait, demeanor, her grooming, if she clean or not, and her mood, if there is any signs of anxiety or depression. And after that, I will obviously start the examination. Hello, Miss Dina. I'm Angela Dorfman. I'm nurse. I'm going to do your physical examination. I want you to sit down here. Thank you very much. Could you please tell me why do I see you today?
It's just an annual checkup.
Okay. Do you have any concerns, any pain anywhere, anything that you think that going wrong with your body? Not at all.
No.
Okay, very good. So, for the purpose of this examination, I have to touch you, and I need your permission to do that.
Yes.
It's okay. Okay, obviously we are not going to expose you so much. I'm going to take your pulse. I'm going to take Dina's pulse for the 10 seconds and multiply them times 4. And keeping my fingers on her pulse, I'm going to count Dina's respirations. Okay, so pulse is 65 and your respirations is 13. Okay, so we start from the head to the toe, and you will be in sitting position and laying down on the bed. Okay, so I will start with your head. So I'm going to look on your face. I'm going to touch you. Okay. Okay, face is symmetrical. Okay. I'm going to look your hair. You are clean, nice and healthy. No flakiness, no dandruff. Okay, I'm going to palpate your head. Do you feel any pain or tenderness?
No.
Good. Now I want you to squeeze your eyes as much as possible. Okay. Open up. Smile for me. With all teeth. And frown. Okay, I want you to puff your cheeks. Okay. Very good. Now I'm going to do a little sensation test. So I'm going to take this cotton ball. You will close the eyes and you will tell me if you feel it. And you will tell me now when you feel it. Okay? Close your eyes.
I feel it. Feel it. Feel it. Feel it. Feel it.
Okay, very good. You can open your eyes. Okay, I want you to move your jaw side to side. Okay, I want you to turn your head to the side. Like other side. Okay. Okay. Very good. Now I want you to turn your head to the side of my hand. It's like resist. Okay, very good. Another side. Okay, very good. I want you to shrug your shoulders. Shrug your shoulders. Okay, put them back. And now try to do that again. Okay. So your cranial nerves 5, 7, and 11 intact. Okay, now I'm going to palpate your lymph nodes. Okay. Tell me if there's any pain or tenderness. Occipital, postauricular, auricular, okay, submandibular, segmental, cervical, subclavicular, tonsillar. Okay. I'm going to palpate your trachea, positioning and mobility. Okay, I would like you to turn to it this side. And I'm going to palpate your thyroid gland. I want you to swallow for me. Swallow again. Okay. Okay, now we are going to move and inspect your eyes. With the pen light, I'm going to check your eyes for the direct and consensual reaction. So I'm going to shine the light 2 times in each eye. Okay? So I want you to look at me. Okay. Good. Very good. I can tell you that your pupils are equal, round and reactive to light and accommodation. I want you to look up, please. I will check your conjunctiva. Okay, we can see that conjunctiva is pink and moist, sclera is white, cornea transparent. Gaze. So I want you to follow my finger. Yeah, that's what everybody likes. Now we have to do visual acuity test. Okay, Dina, I want you to read 2 last lines. I want you to close one eye. And please read 2 last lines.
CFDHJ LTFIN.
Very good. Now I want you to close another eye.
DFDHJ LTFPH.
Okay, very good, Dina. Now I want you to read with both eyes open.
CFDHJ LTFPH.
Very good. Dina, you have visual acuity 20/20. Now I'm going to inspect further your eye. Your eyes. I'm going to shine the light. Okay. Drink. Okay. See red reflex? Okay. Now I'm going to look in your eye. Open your mouth. Open your mouth. And another one. Okay, very good. So this red reflex, and we saw your optic disc, which is round with distinct margins, which is very good. So Dina, we inspected your cranial nerves 3, 4, and 6, and they're intact. Okay, now I'm going to move to your ears. So, do you have any problems with hearing?
No.
So let me palpate your ears. Any tenderness? No, everything is good. I'm going to put the otoscope in your ear, just 1 centimeter. So I'm going to visualize your canal and tympanic membrane. Okay? Okay, let's do it. Let's do this. Okay, canal is button, nose, cerumen, tympanic membrane is pearly gray, translucent. Okay, let's do another ear. Okay, again. Canal is button, nose, cerumen, tympanic membrane is pearly gray and translucent. Okay, very good. Now we are going to do a little bit more fun test. This is dream fork. We are going to do a Weber's test. Could you please put your hair around your ears? Yes. So I'm going to do vibration, that is vibrate, and I will put it behind your ear, and you have to tell me when vibration will stop. Okay? Okay. Now I want you to tell me when sound will stop. Okay. Another ear. Okay. Sound. Okay. Very good. Ears are intact. Tina, do you have any allergies?
Yes.
You do have allergies. Do you take any medications for that?
Yes, I take 10 milligrams of cetirizine every night.
Okay, does it help you?
Yes.
Okay, very good. Now I'm going to inspect your nose. Okay, I want you to breathe for me, like blow your nose. Okay, okay, very good. I'm going to shine the light inside. Okay, because it's moist and pink. No subtle deviation. Good. I'm going to palpate your nose. So bone is firm. Now I'm going to palpate your sinuses. You will see if there's any congestion, that frontal sinus, any tenderness, and maxillary sinus, any tenderness. Okay. Do you have normal sense of smell? Okay, so olfactory nerve number 1 is intact. Okay, now we are going to look in your mouth. Okay, I want you to say ah. Okay, both palate, hard and soft palate looks good. Good. I want you to move your tongue. I want you to stick out your tongue. Okay, very good. I'm going to depress your please, and I will depress it. So we are going to check your teeth. Teeth look good. Open wider your mouth. Okay, very good. Gingiva is normal. So you will in the middle. Tongue looks normal and healthy. Teeth are good. Gingiva is okay. No bleeding, no swelling, no anything bad. Okay. Okay, Gina, I want to tell you that cranial nerve 9, 10, and 12 is intact. So now we are going to do back and thorax exam. I would love you to stand up for me, please. And please turn this in front of me. And I want you to bend and touch your toes with your fingers. Okay, and I'm looking for some spinal depressions, the scoliosis. Okay, you can stand up, so no scoliosis. You can sit down. Okay, Dina, I want you to breathe. I want to see how you're breathing.
With my mouth? Oh.
Normally. Let me check your arms. Okay, we are going to check capillary refill, but Tina has beautiful manicure. We will pretend that we can see that capillary refill is okay. Skin is pink. Turgor is okay. Let's see. Okay. Could you please put your fingers like that? I'm looking for clubbing. Yeah, very good. Yeah, no clubbing. Okay, now I'm going to do inspection of your back, so your lungs, but posteriorly. I want you to turn a little bit. So I'm going to put my hands and I want you to breathe deeply, okay? I'm looking for posterior lung expansion, and I'm looking on the movement of my fingers. Everything is symmetrical. Okay, now each time I put my hands on your back, you have to tell 99. We are looking for tactile fermitas, and I'm looking for consolidations and masses in your back and your lungs. I mean. Okay.
99, 99, 99, 99, 99, 99.
Very good, Dina. No masses, no consolidations. Now I'm going to listen to your lungs. I want you to breathe deeply, okay? So I'm going to expose your back just a little bit, okay? Is it okay with you?
Yes.
Okay. Okay, let's start here. Okay, let's start here. Okay, sounds good. Let's do the same thing, but anteriorly on the front. You do the same thing, you whisper me. Okay, it's bronchial sounds and vesicular sounds. Okay, very good. Your lungs are clear, no stridor, no crackles, no wheezing.
Beautiful.
Everything is good. So now, Miss Dina, we are going to check your heart. So I'm going to listen to you again, and in sitting position and laying down position. Is it okay with you? So at first I will check for the precordium. Point of maximum impulse. Okay. Now we are going to listen to you. Your heart sounds. Okay, so okay, aortic. Pulmonic. Second pulmonic. Tricuspid. Mitral. The same thing I will do with the bell. Aortic. Pulmonic. Second pulmonic. Okay. Tricuspid. Mitral. Okay. Have you ever had murmur? Heart murmur?
No.
No. Okay, I want you to lay down
On my back or stomach.
on your back, please. Okay, again, palpating precordium. No bruits, no hips or thrills. No, just okay. Okay, and again. Aortic. Pulmonic. Second pulmonic. Mitral. Tricuspid. Okay, point of maximum impulse is fifth intercostal space, mid-clavicular line. So when I'm listening to you with my bell, okay, aortic, second pulmonic, mitral, tricuspid. Okay, now we are going to check jugular vein distension. So obviously for that we have to put the patient on 45-degree angle, and I want you to turn your head this way. So I'm going to palpate it. Okay. So one ruler right there on the sternum, and another ruler we are going to put like 8 centimeters. So now you continue laying down, and I will do abdominal examination. I'm going to expose a little bit your stomach. So for the abdominal exam, we usually go in different pattern. We start with inspection, auscultation, percussion, and palpation. So I'm inspecting Dina's stomach. It looks flat, symmetrical. Okay, now I'm going to listen to your bowel sounds in all 4 quadrants. Okay, very good. Now I'm going with the bell of my stethoscope. I'm going to listen to your aorta. Okay, no good. Bowel sounds are present and positive. So now I'm going to percuss your stomach. So we are going to listen to the tympanic and dual sounds so we can locate your organs. Okay, now I'm going to palpate you. Breathe in. You're palpating your liver. Okay, very good. Liver is healthy. Okay, now, okay, very good. That was abdominal examination. Okay, let's check your lower extremities. Okay, let me see your knees. Any tenderness, any pain? Okay, we will do that test. We will see if there is any fluid. No. If it would be fluid, it will gush back. And we'll see it. Okay, now I'm going to do a range of motion because I see your skin is good. Okay, let's do it. Bend your knee. Okay, very good. Let's do abduction and adduction. Okay. Bend your knee. Bend your knee. Okay. Now I will do that for you. Okay. Now let's check your pulses. Okay, let's check your feet. Let's check your... Okay. This feet, let's bend it. Let's do capillary feel. Let's do plus. It's good. Okay, let's see if you have swelling or edema. Okay, very good, Dina. You can sit down now. I want you to walk for me. Okay, now I want you to walk toe to heel like that. No, toe to heel. Toe to heel.
In a straight line.
In a straight line, yes. Okay, come back. Okay, come back. Okay, just Romberg's test. I want you to stay
Parallel.
yes. I want you to close your eyes. The balance is good. Okay, but you just sit down again. Okay, before that I want you to put your arms ahead of you. You are stronger than me. Do not let me to push in your arms. Very good. The same as with your legs. Do not let me push. Okay. I just put your like that. Resist. Do not push. Do not let me to push them. Okay. That's me. Okay. Very good, Dina. I'm going to wash my hands because Miss Dina. Now we are going to do a sensory exam to test sensation in your hands and your legs. I'm going to touch your hands and your feet, and you have to tell me if it is dull or sharp. So that would be dull, that would be sharp. See any difference? Okay, so close your eyes and tell me dull or sharp.
Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Close your eyes.
Sharp. Sharp.
Okay, not bad, Dina.
Jetzt mal an.
Okay, now I'm going to do your biceps reflex. So that's a hammer. Okay. So I'm going to strike my finger. Okay, just relax it. Okay, let's do biceps reflex. Okay, very good. And brachioradialis. Good. Now we do again. Arm. Okay. And triceps. Again, brachioradialis. Okay, very good. Now we are going to do patellar reflex. Just so move a little bit. So, okay, patellar reflex. Okay. Now Achilles reflex. Okay. Okay, let's do plantar reflex. The Babinski.
Huh?
Babinski reflex. Okay. It's okay. Okay, it's negative. Now we are going to do coordination and cerebral function tests. The first one would be test for rapid alternating movements. For that, I would like you alternate between pronation and supination of the hands. So, could you please put your hands on your knees and flip them over and back and repeat as fast as possible. Over, like that, like simply. And do it as fast as you can. Very good. I want you to put your feet on the floor and tap as fast as you can. Okay, very good. Now we are going to do point-to-point test. I want your index finger to put on your nose. And now touch my finger. So wherever I will move my finger, you have to touch your nose and my finger with your index finger. Your nose, the tip of your nose, and my finger. Nose, finger. Okay, point-to-point test, the last one I want you to do. I want you to put your heel on your shin. Okay, like that. And I want you to go all the way down on your shin and come back. Do it again, again, and again. And with your other leg. Okay, you passed. This test is rapid repeating movements test. Okay, now I want your index finger to touch your thumb. Now your thumb should touch each finger back and forth as fast as you can. Okay. Okay, very good. And I can tell you that your coordination is very good, Dina. Do you have any questions for me?
No.
Our exam is finished. Thank you very much. You will get your recommendations later. And I'm going to wash my hands right now, and I have to say you goodbye.